Well, the international work again is, in some ways, it's a function of chance in my life. So, for example, I was at a conference in Italy, speaking about some of our mental health and justice work at the time, and I ran into a psychiatrist from Japan who invited me to go to Japan because I was doing a presentation on assertive community treatment teams and case management. And at that time in Japan, they had been told that the government wanted to close, I believe, 32,000 psychiatric hospital beds, and they were looking for a way to close the beds. Um, and This particular psychiatrist felt that assertive community treatment teams might be the recipe. So he invited me to go to Japan, and I visited a number of centers and a number of programs. And I talked about what we were doing on community mental health in here in Canada. And I was also interested in going to the birthplace of the community mental health movement, probably in the world, and that was Trieste in Italy, where um, they actually have the lowest rate of people in the justice system with mental health issues, people in the forensic system, because they've built a truly community system. It's a small city, but each city has what they call a community mental health center, and they, rather than hospitals where people would, as they do here, wait hours and emerge. They actually have vacant beds in their what they call their hospitality centers, and that's because they have team-based services right in the community, and they've been doing this since the 70s. So I've been fortunate in that, and my trip to Italy was I wanted to learn about how they did it, and I did. Um, and then, a colleague of mine asked if I could do some work to help Kyrgyzstan develop their national mental health plan, and I went in 2007 to help them do that. And again, I built on what do we know about effective community mental health programs. Now, I have to say that like many of the plans we write here, it's a good plan. But they, like we, suffer from implementation deficit disorder, and they've had so many changes in government, probably nobody even remembers that the plan was developed. We also had a really neat experience where we were able to develop a partnership with the Schizophrenia Care and Research Foundation in Chennai, India, beginning in about 2004. And we were able to go, and we brought colleagues from CMHA and across boundaries to one of their conferences to talk about our work. And as well, we did a staff exchange with them when we hosted the International Mental Health Leadership Initiative here in 2007. So again, we've taken advantage of opportunities that have come my way and our way. Right now, we're working with the Wellesley Institute and CAMH to develop a Thrive movement around building the mental health of cities. That's part of the iCircle movement that the International Mental Health Leadership Group has developed. And again, that's a great opportunity for CMHA. One of the things that is being highlighted, even in terms of our Thrive work, it builds on what we're doing every day. So there's work on mental health literacy. There's work in the downtown east side to up the community capacity, particularly with addictions. And then the Supportive Housing Growth Plan, which is a major project for us in a partnership with the Wellesley Institute and the Toronto Alliance to end homelessness. That's also a feature of our Thrive work. So again, our international work builds on the stuff we've been doing here in Toronto, and it creates great opportunities for us to learn from others. And in fact, next week, and this was a call that came in from out of the blue, but Kathy Chow, Frank Siritich, Mandy Calver, and I are and also Ayun and Amy Sang are doing a workshop on CMHA's work, both in relation to health equity and our work on mental health and justice and forensic services for a group of colleagues in the UK. We're going to be doing 2 webinars with them. Again, so these things sort of happen by chance, but it's a great opportunity to showcase our work, and it's a great opportunity for us to learn.